Hi, I'm Dr. Lowell Keppel.
And I'm Dr. Kara Trichler from Natural Family Healthcare.
Yeah, and so today we're going to talk to you a little bit about a wonderful device we have called the heart sound recorder. So as you know, heart disease is still the #1 killer in America.
Which is crazy, really.
After all these decades, right? And more people are getting heart disease, and we see research that's coming out talking about younger, middle-aged women primarily, rate of heart disease is going up. And so we felt very compelled to do heart sound recordings on our patients.
Yeah, exactly. And kids. How many kids do you see in the news that are just dropping dead on the athletic field?
Yeah, and that's why we have AEDs in all the schools now, which is a great life-saving step. But what do we want to do? We want to be able to pick up these conditions before they become a real problem and see the signs that the heart is going downhill for a person. And then what we can do is use some nutritional supplements to help that out, because history has shown that heart disease is really a nutritional deficiency, started in the 1880s.
Yeah, and the great thing too is it also can help, the heart can show us other things that are going on in the body and give us some ideas to help other areas before they show up really.
Yeah, and that's absolutely right, because the body wants to make sure two things get its nutrition, the heart and the brain. And so if we see nutritional deficiency in your heart, we're going to see it other places in your body as well.
Yeah. Yep.
Yeah. Why don't you tell them a little bit about the heart sound recorder?
So the heart sound recorder is a really simple device. It's non-invasive completely, and it basically is a major step up from a stethoscope. So stethoscopes were invented many years ago.
About the 1800s.
1880s, yeah. To listen to the heart so doctors could find out what's going on. Hear the heart, see if there's anything happening. Well, the heart sound recorder has a microphone that detects the movements of the heart valves so that we can actually make a graph and see things earlier on than what human ears can't hear with the stethoscope. So.
Right, and the heart sound recorder, this actually isn't new technology. It's called acoustic cardiography, which has been around since the 1930s. But this is now stepping into the 21st century by having the microphone feed into a computer, so now we can get an ideal graph. We can get a very beautiful graph of your love dubs, your first heart and second heart sound, your love dubs.
And we can see those resting rates, if they're where they should be, the heart rate, all those little nuances that we want to see with the heart.
Right, the rate, rhythm, and tone is what we're going to be taking a look at.
Yeah, so just going to kind of show you a little bit of what it looks like to come in and get a heart sound. It basically takes maybe 10 to 15 minutes to really do the heart sound. It's really the after, looking at the nutrition, doing some things, and doing the follow-up that takes the longer piece of it. Doing the actual recording, it's about 15-second recording on each valve of the heart, so it doesn't take much time at all. So what we're going to do is, we have a heart here. The heart has 4 chambers, so we have 2 upper chambers and 2 lower chambers. So we're basically going to put this little microphone where those sounds would be heard, or well, the movements that create the sound from the valves would be seen. So we're going to get one of the mitral, get one of the tricuspid, get one of the aortic, and get one of the pulmonic, okay?
And these locations have been used by doctors for, what, a century and a half now?
Yeah.
Ever since they realized that, hey, we can really hear the mitral valve better here. So.
Yeah, so I'm going to use Dr. Keppel here and show you just how this guy works out. So we're going to take this microphone, we're going to set it right here, have him hold it in place while I reach around and get this on nice and snug, because we don't want this moving around. We want it to be nice and snug, close to the surface as we can. When you come in, ideally we like to be able to have a nice flat surface. So if you have a big bulky sweater on because it's 12 degrees like today, if you have an undershirt on, that would be great, so we can take that sweater off, take off the jacket. If not, we do have some gowns that we can put on you so that we can get a better
gowns.
Yes, they're very becoming. Yes. So here's where we would be. Get his mitral valve. We have him sit on back, relax, keep his hands in a neutral position, his feet in a neutral position. We don't want you looking around. We don't want you fiddling. We don't want you talking, because all of those things create movement that the heart sound recorder is going to pick up. The microphone's going to pick up those little movements. We want you taking nice, easy, relaxed breaths. We don't want you increasing your breath rate or trying to hold it or trying to breathe faster. just nice and relaxed breathing and sitting in a still position, okay? And then once we have that one, we're gonna have him set on up. My strap's way over here for some reason. And we're gonna loosen a little bit, bring it up just a tad so we can get right over that tricuspid, and then we tighten it back up, set him on back, do our next recording, okay? Then we have him set on up again, come up, bring those arms way up to the sky so we can get that nice and high, get it tight again. I always kind of joke with patients that this may be what a straitjacket might feel like. I'm not sure, I haven't ever had one on, but who knows someday. Button up the shirt, get that nice aortic sound, and then we're going to come right over and get a good recording of that pulmonic. And that's it. Super simple.
Yeah, and like you said, it only takes about 15 seconds over each area to get a good graph. And the other beautiful thing about the heart sound recording is it's giving us a graph of what your heart is doing right now today. The heart will compensate for what's going on in the body. So different times of year, we might see that the heart is showing us a nutritional deficiency. For instance, when we drop a second sound, that could be a decreased calcium in the tissues. Well, that can happen at the end of the summertime because we're not transporting calcium into our soft tissues the way we should.
Yeah.
So I like to recommend a person gets it done at least 4 times a year, even if their heart's healthy.
Yeah, it's a really great protocol. It's wonderful. We've seen a lot of patients come in that didn't have anything going on with their heart and were just curious to see what this was all about. So they had a heart sound recording and we saw some things that we were able to do, and they found improvements in energy and sleep and things like that that they didn't attest to the heart. And then we've had patients come in that have been in a myocardial infarction episode and are now seeing cardiologists and everybody, and we're doing some things to support them so that they feel better, which is great.
Absolutely.
So whether you've had heart issues or you haven't, it can show you some great information.
But more importantly, if you have a heart, you need to make sure it's working okay.
Absolutely.
Because heart disease can be a silent killer. You know, one of the first signs of a heart attack is death.
Correct.
Right, sadly.
Yeah.
So give us a call.
Yeah, call Alicia or Michelle at the front desk. They'd be happy to get you in for a heart sound recording with me or Dr. Keppel, and we would love to help you out. And since it's February, which is
Heart Month. Yeah.
We would love to get that going now.
So what's the phone number?
Phone number for the office, 303-427-2414.
Thank you.